It is a common stereotype. Men don't go to the doctor. But unfortunately, there is data to back it up. According to a recent study, more than 88% of working-age men have untreated health issues. Luckily, there is help right here on the Suncoast. We welcome Dr. Christina Captain from Sarasota Center for Acupuncture and Nutrition to share how we can help treat men's health issues. Great to see you.
Good to see you, Joey.
This is a topic, obviously, it's very important to me. So, all right, you heard that data. That's kind of alarming. What have you seen in your practice as far as men's health issues come up? What are some of the common ones you hear?
So, primarily, it's going to be energy. I'm tired. I've got fatigue. I'm losing muscle mass. I have a decreased libido. I don't have a sex drive anymore. You know, I have brain fog. I don't have any motivation. This kind of thing is pretty much rampant, right? Barring things like digestive issues, which are more specific. Insomnia, which is more specific, something like that. Those are different kind of ailments that men will come in for, or anxiety even. But the ones I just mentioned, are the primary ones.
Well, now, all right, some of those sound like maybe just a part of aging, right? And we are expected to be a little bit more active, and we're working longer, we're living longer. So how much of that is aging? How much of that is now testosterone being a big buzzword in men's health?
Those are pretty much tied in together, right? Because as we age, testosterone definitely reduces, both for men and women. And both sexes need testosterone, don't get me wrong, we need it. However, it's maybe a problem to just look primarily right at testosterone as the only solution. It's sort of like giving a Band-Aid to something that has a deeper root problem. And really in Eastern medicine, that's where we're looking. Functional Eastern medicine, we're looking at the root problem. Why did testosterone drop so much? Why is it having all of these other effects?
I love that this is a big part of your treatment, is that you don't necessarily go right for the symptom, but you go for the root cause. So all right, as we're driving down the 75 or we're online, we're getting hit with these ads for testosterone replacement therapy. Tell me about what is available. What are your thoughts on all of that, and what's available at your practice?
So testosterone, like I said, is probably a symptom of a deeper root cause. And what we're missing there is the actual symphony between the HPA axis, which is the hypothalamus, the pituitary, and the adrenal glands. And the adrenal glands are these beautiful little glands that sit on top of the kidneys that help us with, you know, the fight or flight kind of deal, you know, give us the energy to get up in the morning via cortisol. That should be lowered at night when we go to sleep, right? It produces adrenaline, and it really produces DHEA, which is a precursor to making testosterone. So what happens is when we are under such chronic stress, whether it's high grade or low grade, but chronicity is the piece. If it is a chronic stress issue, we are going to have real big problems with our adrenal glands. And that symphony I talked about, those hormones that we need to live correctly. So once that adrenal dysfunction starts, then all of our focus is on fight or flight and survival. So everything gets pushed towards cortisol, right? And we lose our push towards DHEA and testosterone, specifically more so in men, because that's your primary hormone, right? So, and testosterone can even convert to estrogen under stress. So then we have men really gaining a lot of weight, having gynecomastia, which is breasts, as a male. And so we can have a lot of issues around that as well. But those symptoms, everything I just mentioned, are all about this root cause typically. So what we want to do is find out how we can fix the root cause. Doesn't mean you can't get testosterone if you love it, and most men do love testosterone, of course, replacement. Women do too. But it doesn't mean that you don't want to fix the root, so maybe you can lower your dose. Because excessive exogenous, which is not made by your body, so endogenous is something made by your body, exogenous is something that's made in the lab or comes out of you know, the environment. So you're getting this exogenous testosterone at higher and higher doses because nobody ever fixes the adrenal dysfunction. And so then you're at risk for cancers.
All right, this is good news for some of us. Like, I'll be honest with you that I did have my testosterone tested. It was not low enough to get the therapy. So I thought, okay, well, that was the one fix then. So what's it going to be? So it sounds like no matter your testosterone levels, if you treat the root cause, then you can still get relief from some of these symptoms.
Exactly. And so what causes more and more stress? Lack of sleep, right? Poor diet, lack of exercise. And when you have low adrenal function or adrenal dysfunction and low testosterone, you don't have the motivation to go out and exercise. You eat more because it's comforting and probably not the greatest of foods, right? So we have those kinds of things where we're going to want to incorporate lifestyle choices, right? But acupuncture in and of itself absolutely treats adrenal dysfunction. We know acupuncture is actually primo for so many of these kinds of issues. So it helps with sleeping, it helps with insomnia, right? It actually produces neurotransmitters, actually it lets the brain elicit more neurotransmitters and neuropeptides, which are serotonin, dopamine, endorphins.
Yes.
So you're sleeping better, your mood is better, it's going to help increase DHEA, calm the body down, so less cortisol, which means you can lose more weight out around the middle, less cortisol, more DHEA, more testosterone, so bam, 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 everything works great with acupuncture.
And less of these external hormones coming in. All right, I love this. 25 years in the community, congratulations.
Thank you.
Certainly have seen all of it, and I love that you have so many different ways to treat what might be ailing us. You can learn more about the treatment options, everything that Dr. Christina Captain offers at the Sarasota Center for Acupuncture and Nutrition by visiting the website scansrq.com. We'll be right back.